We're here in Williamsburg today to deal with a very serious situation. This is the epicenter of a measles outbreak that is very, very troubling and must be dealt with immediately. The message today for all New Yorkers is to take measles seriously.
Good evening and welcome to Metro Focus. I'm Rafael P. Roman. Take measles seriously. As you heard Mayor de Blasio say, the measles outbreak is now a public health emergency in parts of New York City, and the disease is spreading fast. Just under 300 new cases of the virus have been reported here in the city, overwhelmingly in Brooklyn and primarily in the heavily Orthodox Jewish section of Williamsburg, where roughly 230 people have contracted the disease since October. According to the CDC, the anti-vaccine movement is partly responsible for 100 of the new cases that were reported just last week. By comparison, there were only 2 cases of measles reported in the city in all of 2017. Across the country, there have been 465 cases reported in 19 states, with most of the illnesses occurring in children. And the number of people infected climbed by approximately 100 during the first week of April, with 4 states, Florida, Indiana, Massachusetts, and Nevada, reporting their first cases of 2019. It was just 19 years ago that the CDC announced that measles had been eradicated in the United States. For now, as part of the mayor's declaration, people living in the selected zip codes who have not been vaccinated and may have been exposed are required to get the vaccine.
We cannot allow this dangerous disease to make a comeback here in New York City. We have to stop it now. Today, we are declaring a public health emergency effective immediately. This will mandate vaccines for people living in the affected area. Department of Health will issue violations and fines to people who remain unvaccinated.
For weeks, public officials and health experts have been advising parents to keep their children out of school if they have not been vaccinated. And going one step further, some New York lawmakers have introduced a bill to help underage children get vaccinated without parental consent if they wish to be vaccinated. Jack Ford recently had a chance to talk with Dr. Devi Nampiaparampil, associate professor at NYU School of Medicine, and he began the conversation by going back to the basics and asking what we do and do not know about this increasingly dangerous virus.
Measles is a deadly disease. Now, normally when we think about dangerous and deadly diseases, we might think about HIV, Zika, Ebola. These are the things that we hear about because we have always been exposed to the vaccine for the most part, right? So it's been much safer. We don't hear about people typically dying from measles. Now, before the vaccine, before 1963, when people recorded this, there were about 6,000 deaths per year across the globe related to measles. That's CDC data. Right. So now with measles, the symptoms that people have are typically regular cold symptoms at first. So they can have runny nose, maybe a cough, high fever. So not something that you would necessarily spot. But as it evolves, then people can get a rash that comes kind of head to toe. But if it progresses, people can get hospitalized. And in the worst case scenarios, they can have brain swelling, you can have deafness, and then you could have death, right? So any of these things could potentially happen. And the estimate right now is that for every 1,000 kids that get measles, 1 to 2 will die.
Talk about the vaccine. What does the vaccine do to protect us against measles?
The vaccine is a teaching tool, like any vaccine. So it's basically that you're exposing your body to either a weak or, part of a virus. So any vaccine will do that. And then your immune system can fight it and just learn from that process how to fight the real virus if it ever comes in contact with it. So basically, by getting vaccinated, you don't have a 100% chance of being protected from measles, but it's in the 90% range. So it depends, 93 to 97%, depending on how many doses you get, right? So even a person who has been vaccinated twice is still at risk of getting the measles. And if you haven't been vaccinated, you have a much higher risk. Now, there is a protective effect. So the issue is that the World Health Organization estimates that if 95% of people get vaccinated, so 95%, then each person who's been vaccinated acts as a shield, a human shield against the virus, right? So even if you don't have the vaccination, if you're surrounded by people who have been vaccinated, you too will be protected, right? So there's a public health issue here. And at the same time, if you have a certain threshold of people who don't get vaccinated, even if you are vaccinated, you are still at risk. This is one of the most contagious viruses on Earth. So it can be spread just being in the same room. Even if a person who had measles leaves the room for 2 hours, the virus can sit there and you can catch it.
Why have we seen, most recently, this anti-vaccine movement?
Well, I've seen a couple different things just even in the past 10 years. So about 10 years ago, the main concern people brought up was autism, that vaccines cause autism, right? Now that
There's
has
a
been...
report that got out that has since been discredited.
Exactly. So it's been discredited. The person who wrote it was accused of fraud. On top of that, there have been several studies that show that that's not true. Then as time evolved, I heard different things that, oh, if you get the vaccine, you get the illness, so you can get sick from the vaccine. Now, that is not true either. But nevertheless, the newest thing that I'm hearing, which I think is the most concerning, is more this attitude that we don't need the vaccine because this illness has been eradicated, right? Which up until recently, for about 20 years, we thought that we had defeated measles. So the issue there is that the people who promote this idea, I think, understand the herd effect to some degree. So they understand that if you're surrounded by people who are immune, then you might be protected as well, right? But the issue there is if you don't get vaccinated and if everybody kind of assumes that same attitude, then none of us are protected. The vast majority of people are going to have a significant benefit from having the vaccine. And not only that, you protect the people around you.
If this proposed legislation gets passed, which essentially says that children who ordinarily would be considered underage, they can get vaccinated even without the consent of their parents. If it gets passed, obviously, as a physician, you have the weight of the law on your side. Would it be concerning, do you think, even though the law would be on your side for physicians, to have to deal with this notion of parents saying no and the child saying yes?
I think it's difficult. So first of all, I am in favor of the kids getting vaccinated, even if the parents are opposed to it. I think it's better and safer for the child and for the community.
If it's going to save a life, as opposed to getting somebody angry, I think that's an easy decision.
Exactly. But it's not consequence-free, right? So the issue is, let's say then you have a conflict with the parent. Well, you could have legal issues related to that. People could be concerned about malpractice, right? They could be concerned about insurance issues, who's paying for this. And then more importantly than that, I think if you have a conflict with the parent, right, maybe they won't bring that child to see you again, and maybe there's another issue that could be dealt with or treated, or some other health concern that the child has or the parent has. So it's really very tricky.
Not at all simple. It is always a pleasure to have you here, and I've said this before, I always feel much smarter after I have a chance to talk with you. You did a great job explaining this all for us. You be well.
Thank you.